Phlebotomy technician practice question. Question 1. How far above the venipuncture site should the tourniquet be wrapped around the arm? 1 to 2 inches. 3 to 4 inches. 5 to 6 inches. A tourniquet should not be used. The tourniquet should be placed 3 to 4 inches, 3 to 4 finger widths, above the venipuncture site. This distance allows adequate vein filling without excessive pressure on arteries or nerves, ensuring proper blood flow while maintaining patient comfort. Question 2. The color-coded tube that is most frequently associated with coagulation tests is light blue, lavender, green, red. Light blue top tubes contain sodium citrate, which preserves coagulation factors by binding calcium. These tubes are used for PT, PTT, and INR testing. The proper blood-to additive ratio, 9:1, must be maintained for accurate results. Question 3. Areas from which blood should not be collected include all of the following with the exception of basilic vein, hematoma, arm with N4, arm with a fistula. The basilic vein is acceptable for venipuncture, though it is often the last choice due to its proximity to the brachial artery and nerves. Hematomas, arms with 4 infusions, and arms with fistulas should all be avoided to prevent complications and inaccurate results. Question 4. If blood begins to flow and then stops when an evacuated tube is pushed into the needle, the most likely cause is use of a 21-gauge needle. Angle of the tube is too high. Bevel of the needle resting against the vein wall. Tourniquet is too loose. When the needle bevel rests against the vein wall, blood flow is obstructed even though the needle is correctly positioned. Gently rotating or slightly withdrawing the needle can reposition the bevel and restore blood flow without restarting the venipuncture. Question 5. The color-coded tube that is most frequently associated with hematological tests is red, green, lavender, light blue. Lavender top tubes contain EDTA, which preserves cell morphology by binding calcium and preventing clotting. These tubes are essential for complete blood count, CBC, differential white blood cell count, and red blood cell morphology testing. Question 6. A postprandial specimen is collected directly after a meal is consumed, 2 hours after a meal is consumed, directly before a meal is consumed, while the patient is fasting. Postprandial means after a meal, but in clinical practice, a postprandial specimen is collected before a meal to establish a baseline. For glucose tolerance testing, specimens are collected at specific intervals after a meal to assess carbohydrate metabolism. Question 7. Which of the following is the most critical affected analyte in a hemolyzed specimen? Potassium, albumin, total protein, calcium. Potassium is found in high concentrations inside red blood cells. When hemolysis occurs, intracellular potassium is released into the serum or plasma, causing falsely elevated results. Even slight hemolysis significantly affects potassium levels, which is critical for cardiac function. Question 8. Alcohol should be allowed to dry completely prior to skin puncture to prevent stinging, prevent dilution of the sample, prevent lysis of red blood cells, allow formation of a round drop of blood. What alcohol entering the puncture site can cause hemolysis, rupture of red blood cells, by damaging cell membranes? Allowing alcohol to air dry completely, approximately 30 seconds, ensures proper antisepsis without introducing alcohol into the specimen, which would alter test results. Question 9. If additive contamination occurred from an EDTA evacuated tube, what test would potentially be affected? White blood cell count, differential cell count, potassium level, red cell morphology. EDTA contamination can bind calcium in the specimen, falsely lowering calcium levels and affecting other analytes. EDTA contamination typically occurs when tubes are drawn out of the correct order of draw, allowing EDTA to transfer to subsequent tubes via the needle, affecting potassium and other electrolyte measurements. Question 10. Which of the following represents the proper sequential draw from first to last? Serum tube, heparin tube, EDTA tube. Blue top tube, EDTA tube, sterile tube. Serum tube, sterile tube, blue top tube. EDTA tube, serum tube, sterile tube. The proper order of draw is blood culture bottles, light blue, coagulation, serum, red or tiger top, heparin, green, EDTA, lavender, and gray, glycolysis inhibitor. This sequence prevents additive carryover that could alter test results and lead to diagnostic errors. Question 11. If a patient is critical or an antibiotic needs to be given right away and 2 blood culture sets are collected. Every 30 minutes. Before, during, and after antibiotics administered. Immediately from 2 different sites. Before, during, and after every fever spike. Blood cultures should be collected immediately from 2 different anatomical sites to increase the likelihood of detecting bacteremia and distinguish true infection from contamination. Collecting from 2 sites helps determine whether a positive result represents a true bloodstream infection or skin flora contamination. Question 12. Color coding indicates a needle's gauge, length, manufacturer, anticoagulant. Needle color coding indicates the gauge, diameter, of the needle. Standardized color codes include 18G, pink/green, 20G, yellow, 21G, green, 22G, black, 23G, light blue, and 25G, orange. This system allows phlebotomists to quickly identify the appropriate needle size for different patients and vein conditions. Question 13. When blood is inoculated into blood culture bottles using a butterfly apparatus, the anaerobic bottle is inoculated first. Safety device is activated first. Aerobic bottle is inoculated first. Volume of blood inoculated is increased. The aerobic, blue top, bottle should be inoculated first when using a butterfly apparatus because air in the tubing will be pushed into the aerobic bottle first, ensuring proper oxygen exposure for aerobic organisms. The anaerobic bottle is inoculated second, as it should not receive the initial air from the tubing. Question 14. An individual comes in for an autologous donation. What is this person coming to do? Needs to have their blood drawn. Donating their own blood for their own use. Has a fasting blood test. Donating blood for a family member. Autologous donation means the patient donates their own blood for their own future use, typically before scheduled surgery. Auto- means self, which reduces the risk of transfusion reactions and transmission of bloodborne pathogens compared to donor blood. Question 15. During venipuncture, a hematoma may result from which of the following? The needle is occluded. The needle bevel is against a vein wall. The needle bevel is partially inserted into a vein. The patient has coagulation problems. When the needle bevel is only partially inserted into the vein, blood can leak out of the puncture site into surrounding tissue, forming a hematoma. Proper needle insertion with the full bevel inside the vein lumen prevents this complication. Question 16. Petechiae, tiny non-raised red spots, on a patient's skin when the tourniquet is applied indicates that the patient has high blood pressure. The site may bleed excessively. The tourniquet is too tight. The patient is allergic to latex. Petechiae are caused by rupture of small capillaries due to excessive pressure from an overly tight tourniquet, indicating fragile capillaries. This suggests the patient may bleed more easily or bruise excessively during venipuncture, requiring gentler technique and extended post-puncture pressure. Question 17. What abnormal color will be observed in a serum collected from a patient with jaundice due to elevated bilirubin levels? Red/pink. Yellow. Milky white. Clear. Jaundice causes elevated bilirubin levels, which gives serum a yellow to yellow-brown discoloration. Bilirubin is a yellow pigment produced from hemoglobin breakdown. The degree of yellow color correlates with bilirubin concentration. Normal serum is pale yellow to clear. Question 18. After the last tube is filled, which of the following is done next? Filled tube is removed from the holder. Needle is withdrawn from the arm. Gauze is placed over the needle. Pressure is applied to the site. After the last tube is filled, the filled tube is removed from the needle holder while the needle remains in the vein, allowing blood flow to stop. Only after removing the last tube should the tourniquet be released, gauze placed over the site, and the needle withdrawn. Question 19. What color evacuated tube would be commonly used for coagulation testing? Lavender. Light blue. Green. Yellow. Light blue top tubes contain sodium citrate, which preserves coagulation factors by reversibly binding calcium. These tubes are used for PT, PTT, INR, fibrinogen, and other coagulation studies. The tube must be filled completely to maintain the correct 9:1 blood to anticoagulant ratio for accurate results. Question 20. When is a phlebotomist allowed to use ankle veins to draw blood? Never. If no other sites are available. After 2 unsuccessful attempts at other sites. With a physician's order. Ankle and foot veins should only be used with a physician's specific order due to increased risk of complications including thrombophlebitis and infection. This site is considered a last resort after all upper extremity options have been exhausted.